everyone, how are you doing? I hope you're doing fine. So welcome back to Overlay. My name is Unjiro Nyambura and stay tuned to the end of the video. So today we're going to discuss about pregnancy and a few tips and tricks that I picked from my pregnancy. So what is pregnancy? Pregnancy occurs when the ovum gets fertilized by the sperm, and then there's conception where the baby develops to a zygote, an embryo, then to a fetus, and then to a full baby who is ready to face the world. So that's what we call pregnancy. So when it comes to pregnancy, we have different stages of pregnancy. We have 3 of them, and we're going to discuss them a little bit. The first trimester, the second trimester, and the third trimester. The first trimester ranges from the first week to 13 weeks. The second trimester ranges from 14 weeks to 28 weeks. And then the third trimester ranges from 29 weeks to 40 weeks. All those trimesters, I would say for myself, the first trimester was very, very trying from my end. And then the third trimester for me, the second trimester for me was a bit easy on me. And then the third trimester, that's where I felt like giving up. So when it comes to pregnancy, we expect a lot of changes with pregnancy, be it financially, be it socially, be it physically, be it emotionally, be it psychologically, physiologically. There are a lot of changes that come with pregnancy. So the first, it's always ready to be prepared of what you expect at every trimester, and that's what that's where the clinic comes in handy. So the moment you realize you're pregnant, the first clinic is very, very crucial, and I hope all our medics or our health practitioners could take prenatal clinics very seriously, educate mothers on what to expect at every trimester, so that you're not caught off guard and you're already prepared of what is going to happen. So the moment you realize you're pregnant, what is the first step? The first step is going for the first prenatal clinic. So that's where your doctor will do some few tests, and then they can maybe tell the level of your blood. You can tell if you have any infection. That's why they do a urine test. They do TB screening. They do HIV testing. They also do what is it called? Syphilis test. Because all those tests can affect your pregnancy. So folic acid is very, very important in pregnancy to avoid birth defects and birth anomalies. And then you're given a iron supplement to supplement your level of blood in preparation for delivery. We all know delivery is a very messy and a very bloody procedure. Let's go over the first trimester. The first trimester, I said, it starts from week 1, and the first sign or the first symptom is you miss your period for more than 4 weeks. And if you've been active and you miss your period for 4 weeks, it clicks, maybe I'm pregnant. So that's the first sign of pregnancy. The other thing is your boob becomes very tender and very painful, and especially on touch, they become very, very soft. The thing is you become very noxious, so you don't want to eat anything, and this creates a red flag for most of the people, because you start eating things that you previously wanted to eat. Now you don't want to eat them anymore. You're nauseated. You're able to pick up smells that are very, very faint, and other people are not able to pick up. Your sense of smell is heightened, and also you become very, very moody. You start hating people without knowing what's happening, because also emotionally the hormonal level changes, creates a lot of havoc in your body, and that affects you even emotionally. And that's why you find you're having mood swing. 1 minute you're happy, the other minute you want to cry. That's what happens. The other sign and symptoms that happens is the morning sickness. The minute you wake up, you feel like you want to vomit. Most of the time, you end up vomiting. Let's go to the second trimester. I'm trying to be a bit faster so that my baby doesn't wake up. So the second trimester is a bit easy. I would say from my end, it was a bit easy for me. because by then now the obvious symptoms, the tummy starts showing a little bit because now the baby is growing big. You start having stretch marks on your body, on your thighs, on your buttocks. You experience some stretch marks, and then you start having hyperpigmentation, mostly on your neck region, on your armpits, on your legs, on your forehead. Mine mostly were on my neck and my armpit. I'm still recovering from that. It's taken quite a while actually. So that's the hyperpigmentation starts in the second trimester, and in the third trimester actually it gets really bad. The other thing, the second trimester for most of the people is a bit easy. I would say so, because from my end, it was a bit easy on me compared to the first and the third trimester. Let's go to the third trimester. Yeah, the last one now. The third trimester, I would say, oh, that was not tired. I was really worn out, especially the last month of pregnancy. I was so tired. I was like, I just want this baby to come out and I can relax, because now the tummy is fuller and bigger. Your stretch marks are way visible rather than the second trimester, because your body, your abdomen is overstretching. You're having this dark neck. My neck was very, very black compared to my face. You'd think they don't belong to the same person. My armpits were black, my legs were black, and then you experience swollen feet. If you sit for like 30 minutes, you wake up and your feet are really, really engorged. And then you start having, what else? Yeah, exactly. Now you used to walk for a long distance, or maybe you used to climb stairs. Now you're not able to. You have to stop to catch your breath. You're really tired. And then sleeping positions. Ooh. You try to look for a sleeping position, nothing is working for you. The whole night you're turning in bed trying to get an appropriate position for you to be able to breathe and relax and catch some sleep. And then the other thing, for some people, me, I didn't experience it, maybe you experienced, you start having some lower abdominal pains. They are called forced labor, not to create any alarms, but in case they develop or they progress to more painful and more contraction, that you need to seek a medical attention. But they're just mild and down there, so nothing to worry about. Besides the engorged feet and that's it. So guys, in case you had more symptoms rather than me, you can type down below and maybe you can help somebody else, because maybe I didn't experience everything that the rest of the people do experience. So guys, my baby just woke up, so I'm counting minutes before she starts shouting. So I'll finish the video here. But before I finish the video, there's something I want to insist. So when you get pregnant, you know, the pregnancy and planning for delivery, you have to factor in the mode of payment and where you're going to deliver your baby. So I wouldn't insist more. Get yourself an insurance cover. If it's not a private insurance, just use the government insurance cover. This one, I hope everybody knows this. So just get yourself this. Trust me, itakuokolea, and I'm a witness of that. It's cheap and affordable if you're not able to use the other private insurances. So this one will help you out during your delivery. The other thing I want us to go to discuss about maybe in our next video is this book. This book is very, very important for mothers and fathers at the same time. So we're gonna break it down, whatever is inside there, and then we're gonna discuss each and every page so that each and everyone can understand. Okay, guys? So I'd like to stop there because my baby is making a lot of noise. She needs her mother. So I'll see you next time, guys. So kindly subscribe, comment, share, comment down below if in case you need in case you have an idea of a video that I can do. Otherwise, guys, have a good day, night, morning, whatever time of the day you're watching this.